Hello, English students. Welcome to your English class number 35, advanced level. All right, so today we're going to have one of those special classes that we are pretending we are working in some kind of job. So today we are pretending we are doctors. We work in a hospital, okay? So we have here some vocabulary for things that you should know if you're a doctor. Some things we already heard, some things might be new, and we're gonna have some dialogues that you have to fill to complete the conversations. So let's take a look how this is all gonna work. So first, here to help you to complete the dialogues, to understand everything that surrounds a hospital, we have this first vocabulary, which is working in a hospital. So hospital areas and the specialties. So we start with the hospital area. So what are the names of the areas inside the hospital? So we have the nursery, we have the clinic, we have the ward, we have the emergency room, ER, we have hospital room, operation room, OR, and ICU, intensive care unit. So you have the translation in there for you to take a look. Specialties: cardiologist, plastic surgeon, gynecologist, neurologist, obstetrician, ophthalmologist or eye doctor, orthopedist or ortho, pediatrician, e-therapist. On the other side, we have exams and some other things. So we have ambulance, surgery, blood exam, blood pressure check, prescription, health or medical insurance, natural birth, cesarean delivery or C-section. It's a very common way to say C-section. X-ray, healthy, scan, ultrasound. Okay, very important names. Let's continue. Let's go to slide number 3, where we have medical instruments, body organs, and parts of the body. We have some instruments and supplies. We have needle, scalpel. Let me just correct something here. Stethoscope, adhesive plaster, stretcher, gauze, plaster, thread, tweezers, stitches, syringe. Body organs and body parts: artery, heart, esophagus, stomach, spleen, pancreas, small intestines, large intestines, rectum, trachea, veins, diaphragm, lungs, liver, gallbladder, kidney, ureter, appendix, bladder, urethra, uterus, and skull. That's the last one. On slide number 4, we're gonna have another vocabulary for illnesses and symptoms. So let's take a look. Heartburn, scar, cramps, faint, numbness, shortness of breath, fatigue, wound, injury, stuffed nose, running nose, loss of the appetite, loss of memory, broken bone, bleeding, dizziness, sprain, depression, diabetes, heart attack, high blood pressure, low blood pressure, stroke, anemia, cancer, high cholesterol, nervous breakdown, gastritis, pneumonia. This is good, right? Pneumonia. You don't pronounce the P. Varicose veins, chickenpox, chicken pox, okay? Measles, scabies. All right, so we are done with the vocabulary, and now we're gonna have an activity we're gonna do together in class. All right, so you can plan something, but you only gonna tell me how you're gonna complete it in class. So this one, you have to complete this dialogue using one of these options. So which option makes more sense to complete those dialogues? Okay, so we have the first responder talking to a doctor. So the first responder say, oh, we found this person unconscious or sleeping, losing a lot of air or blood due this bullet wound on his shoulder. And how did you proceed? I covered the wound and tied the knot on his arm to stop the bleed or bleeding. Did you check for blood pressure, vital signs? Yes, blood pressure is low, but he's breathing or burning. Nurse, book in nursery or OR immediately. This patient needs to go on treatment or surgery. So how would you complete this conversation? We have two options on each part. This one is a complete conversation in a doctor appointment. So we have a patient and a doctor talking during an appointment. So we have here the doctor and the patient. So what brings you here today? I've been feeling nauseous and tired, and also yesterday I fainted at work. What do you do for work? I'm a real estate agent. I was at the office when I passed out. I see. How long are you experiencing these symptoms? For about 5 or 6 days. When was your last period? I guess 4 weeks ago. Is there any chance you're pregnant? I don't know. I take my pills. I'll ask for a blood exam to check. Blood test or exam, both are correct, okay? To check if you're pregnant or just anemic. Okay, thank you, doctor. Come straight back here when you have the results. All right, so we have this conversation here. The next one is pretty cool. So give a recommendation for this patient. So you're gonna tell them how they should proceed, if they should rest, what medicines should they take, what they should do to feel better after these things that happen to them, okay? So patient number 1, he says, I have a very strong flu. I have fever and my throat is sore. What should I do? So what would you tell to a patient that is experiencing these symptoms? Would you ask for any exam? Would you give a recommendation for medication? Would you ask the person to be in the hospital? What would you do? Patient number 2. Something important I didn't mention there, but if you're gonna say internado, you say hospitalized. Okay, I'm just gonna add here. So internado is hospitalized. It would be like hospitalizado. All right, so that's one thing extra for you. Let's continue over there. We are on patient number 2, right? So let's continue here. Patient number 2, what's happening to him? I fell off the ladder and my arm hurts a lot. So he was climbing a ladder and he fell. So what would you do if you were a doctor, having this patient? Patient number 3, my back hurts and I can barely walk. Okay, so what should I do? So the patient cannot even walk, so barely. So what would you do? And patient number 4, I burned my hand while cooking. So he has a burn, what would you do? Okay, so let's continue here on slide number 8. What does it say? take a look at the symptoms. What's the diagnosis? So the person is gonna tell you what they're experiencing, what are the symptoms, and which option do you think is happening on this situation. So we have the symptoms and 3 options for you to choose. Okay, so patient number 1 says, my whole body is itching. What is it? Measles, scabies, anemia. Patient number 2, my left arm is numb. I'm dizzy and feeling very weak. These are symptoms of depression, injury, stroke. Patient number 3, I'm late for 3 weeks and now I've been throwing up for no reason. This must be A, pregnancy, B, heart attack, C, chickenpox. Patient number 4, I've been having headaches. I feel tired all the time, sometimes dizzy, and I'm really pale. You must have A, high blood pressure, B, anemia, or C, pneumonia. All right? Okay, guys, so that's it. Slide number 9, we have the videos vocabularies because there are 2 videos, all right? They're short videos. Don't worry, watch them. They are good. They're going to teach you something. So we have here the vocabularies to help you to understand them better, all right? So that's it for today. We're going to practice in class like as we were doctors and see how it goes, right? So that's it. Thank you. Bye-bye. See you in class, all right?